So we just wanted to do a little bit of a refresher regarding our new central line dressing, specifically our new 3M Tegaderms. So before we actually get started on changing a central line, I just wanted to quickly reference a couple of kits that we have here. Just a quick reminder that your yellow catheter trays are going to be your dialysis change trays. Your orange ones are for your PICCs and your IJs, and the purples are going to be for your ports and your portacath. The reason why you want to be able to note the differences is because the Tegaderms and some of the contents inside the packages are different. So for example, we have here the 3M Tegaderm specifically for your port dressing, and this is once again for your purple change tray. The actual port dressing is very different compared to your PICCs, your IJs, and your dialysis catheters. This is noted to be a square, and your 3M Tegaderms here for your PICCs, your IJs, and your dialysis catheters are going to be your circular dressings. In addition to that, we also have a couple of things that you want to note for your port change tray. For the purple trays, just note that if you are going to go ahead and change out your patient's portacath or their power port, please ensure that you're bringing in a BioPatch because this is not included. Okay, so we're going to go ahead and actually walk through a PICC or IJ dressing change. Before we do that, I want to walk through an actual kit and show you step by step what's inside. So note the actual dressing change tray that I chose, which is going to be the orange one. This is exactly how your sterile kit looks like. Once you open it, you have a couple of contents that I want you to make note of. The first two is going to be the mask that you're going to apply to you and your patient. Second is going to be the Purell hand gel, and please note that this faces down. You're just going to press down at the bottom instead of flipping it over. It's going to go right into your face if you do that. So make sure it's face down. The next item is going to be your clean gloves that you're going to go ahead and don to remove the old dressing. This is the absorbent pad that is placed underneath your patient's arm. And last is going to be the alcohol prep pads that you're going to go ahead and use to remove the Tegaderm, the old Tegaderm. So once you've already removed your patient's dressing, you're going to go ahead and open the second flap of the sterile field. You're going to find a second set of the Purell hand gel, so go ahead and do that. And you're going to go ahead and don your sterile gloves. Okay. Once you have your sterile gloves on already, how you're going to open this kit is you're going to place your hands inside the drape and let the drape fall forward. Okay, so everything in here is obviously sterile. We're going to start with your ChloraPrep. So this is what you're going to go ahead and clean your patient's line with. And you can use these sterile gauze to assist you in holding down the actual catheter and cleaning. Okay. So once we're done with that, you're going to let everything dry and apply the no stain barrier film. And this goes around your patient's central line 1-inch border. Second to the last thing is going to be your BioPatch. And note that the BioPatch is not included in your port tray. So because this is the PICC and the IJ, we have our BioPatch included. And we'll talk about the BioPatch in just a little bit. And the last item we have here is going to be your actual dressing and your label. Okay, so let's talk about an actual dressing change now. So pretend for this specific PICC line, I've already cleaned the site with ChloraPrep. I've already prepped my patient's skin with the Cavalon No Stain Barrier Film. So now that I've let everything dry, I'm going to go ahead and place on the BioPatch. So note that the BioPatch this time around is going to be placed really different. Before, we used to teach our nurses to encircle your BioPatch around the PICC line. We no longer want to do that because the new Tegaderms no longer have a actual stat lock. Your Tegaderm is your stat lock. So if you were to encircle your BioPatch, you're going to have a lot more difficulty taking it off when you're going to be doing a new dressing change. So how you're going to place your BioPatch now is just lay it right on top, parallel to your central line. Note here that I have the PICC and the IJ dressing change here. So this is going to be a circular dressing, And there's three parts to this dressing. This part here is the shirt. This on the left hand side is your pants, and this here is going to be your belt. How I place the actual dressing is going to be shown in the next couple of steps here. I want you guys to note that for this specific catheter it is a Bard catheter and it's a double lumen. So how we place this is going to be a little bit different in terms of where your actual biopatch is and where your catheter ends. So if you look here through the window, I want you guys to just note that the stat lock in this specific dressing is right in this area where this keyhole is at. So where you want to aim the stat lock is right at the bottom underneath the wings. It's okay if your wings are sticking out inside the window. You just need to make sure that this area is covered and your biopatch is in your window. Your biopatch should never be half in your window and half in the white part of your tegaderm, and the biopatch itself should never be sitting in the white portion of the tegaderm. So I'm going to go ahead and place this dressing down. As you guys can kind of see here, the wings are sticking up in the windows. It's perfectly fine. But what I have here is that a majority of the catheter is completely covered. So once the dressing has already touched the central line catheter, you're going to pinch down on the middle and ensure that you're pressing down on the rest of the dressing. You're going to lift your catheters up and go around. So make sure your lumens are lifted up and that you're pressing down because this is all pressure activated. Once you've done that, you can remove the rest of the dressing and press down again. Next, we're going to put on the pants. So the pants here is perforated. So I like to kind of remove one side at a time and ensure that you're placing keyhole to keyhole here. So this notch is going to match up to the one at the bottom. You're going to lift up your lumens, place it right underneath, press down to activate that pressure adhesive, place your lumens down, and lift the rest. Okay. Now lastly, you have the belt. So the belt here has a little man, as you guys can kind of see here. He should be standing upright and always to your left hand side. So where the belt should be placed is in between the shirt and the pants. So we want to cover up this specific area of the catheter. So this is your final dressing. Make sure that you have a label on here that shows the date and time and your initials. But essentially, the reason why we want everyone to dress the catheter this way is because, one, the stat lock is in place. It covers a majority of the actual Bard catheter here. Your wings are okay if it's sticking into the window, as long as the bottom portion of your catheter is covered. And secondly, your biopatch is inside the window. Next, I just wanted to show you all how it would look like if you were to go ahead and dress a midline catheter. So see here, for our midline catheters, it's just a single lumen and the catheter itself is pretty short. So you really should have no trouble putting on the dressing for this specific catheter. But note that the biopatch sits right in the middle of the window and a majority of the catheter in the lumen is pretty much covered. So to remove the old dressing, what I like to do is I like to remove everything one at a time. So you're going to go ahead and go piece by piece, take off your belt. And because the belt is still sticky, you're going to want to use the belt to lift up the sides of the dressing. Once we have the edges lifted, The actual picks, the IJs, your circular dressings are really nice because at the bottom here, there is a perforation. So all you have to do is grab both sides of the dressing and tear right down the middle, and everything should basically come off all at once. Once you're here, please note that you no longer have a stat lock, so one of your hands needs to stabilize your catheter. The most important thing about not pulling out the PICC lines is you have to go really low and really slow. So note here how my BioPatch just comes off really nicely with my Tegaderm. That's because I didn't encircle it. So you want to pull your Tegaderm towards the insertion site and never pull your dressing off from top to bottom. So always bottom up. So I just wanted to go over a couple of things regarding our PICC lines. For those that have been asking me questions during routings regarding the dressing change, please note that if your catheter is sticking out just a little bit more than the one that I was doing a dressing change on earlier, you need to really just gauge where your BioPatch is going to be placed and ensure that your BioPatch is in the middle of the window and that your catheter from here below the wings to the end of this where the double lumen starts is covered, because that essentially is where your stat lock is. Again, it's okay if your wings here are sticking inside of the window, as long as this area from below the wings down to where the double lumen starts is covered. Secondly, I also want to mention, if your patient's catheter is sticking out this much, we really want to question whether or not we're able to use this PICC line, because we need to go back and look at the documentation of where this actual PICC was inserted and how much of it is actually sticking out, or if a majority of it was pulled out from previous dressing. So we just want to make sure that we're in contact with the physicians and the PICC team for these specific PICC lines. So I just wanted to do a really quick demo for you all to talk a little bit about the Porter cath and the power port on a patient. So during rounding, a lot of the nurses were telling me that the BioPatch was falling out of the site of placement and into the Tegaderm itself. So my suggestion is, for those of you that are doing a dressing change for a patient with a port, please ensure that your BioPatch is encircled around the needle and it's facing down. Okay, so that should hold the BioPatch in really nicely. So let's walk through the dressing for a port. Note that you're going to be using the square dressing, and there's a couple of options here that you can choose from. For those patients that have a double lumen port, you can use the one at the top. You can also use the larger keyhole here. I personally like to use the one at the bottom for our single lumens. It holds the catheter in really nicely. The lumens fit great, and it's actually pretty simple. So again, 3 parts to this dressing. There is the shirt, the pants on the right hand side, and the belt is going to be on the left. So for the actual port, if you all can see here, you just want to aim right in the middle. And here you don't want to stretch your dressing. You just want to lay it really nicely on top of the wings. Once the Tegaderm touches the wings, you're going to go ahead and push down on the opposite side to secure your site and activate that pressure adhesive. The Tegaderm is really nice because this window here is not sticky at all, so everything is adhesive around. Okay, so once we have the Tegaderm really nice and tight, ensure your lumen is in that keyhole, and go ahead and press down on your dressing. Okay, you're going to go ahead and remove the pants and remove your belt. See how the dressing here gives you a really nice tent in the middle? It holds it in really nice. So here we're going to go ahead and apply the pants. So it comes off Unfortunately, this one doesn't have a perforation, so everything has to come off at once. But the idea behind this is it's going to be keyhole to keyhole again. So I like to place one side down first, lift up my lumens, go down on the other side, and press down. Secondly, I'm going to go ahead and place the belt on. Everything comes off at once. This little guy here is sticking up. He's standing upright, left hand side, and this again is going to go in between the shirt and the pants. So pretty much every part of your lumen and your catheter is covered. How we remove the dressing is the exact same way. You're going to go ahead and remove one at a time. Take off the belt. For this specific dressing, there is no perforation, so you do just have to remove every piece one at a time. So we're going to remove the pants. So I'm using the belt to remove the pants. The pants is off. I'm going to stabilize my catheter. I can even use the remaining dressings to lift up the edges, so it'll help me take off the tegaderm easier. And once I'm here, I can just use alcohol pads or gently remove this from my patient's skin. So just a friendly reminder for our ports and our portacaths, the actual needle itself is changed every 7 days. And if you have any questions, feel free to contact your charge nurses or the education department.